been a professional video gamer. So I did a open tension pneumothorax on a trolley. So this marketing gimmick has fooled the entire population. Left. Surgeons have been judged now is not by how good he's performing, but how good his social presence is.
Okay, so welcome to the first ever episode of Beyond the Scrubs with Dr. Swaminathan. This is part of my alternate career choice now, apart from plastic surgery. So my dear friends have decided to help me out with this podcast. Joining us today is Dr. Abhijit Whatkar, sir. He is a renowned general surgeon and he is one of the well-known names in Pune, practicing general surgery for way more years than I have been practicing plastic surgery. So I'm glad to have you on board. Welcome, sir.
Hi, and thank you for inviting me for your first episode of
of Beyond the Scrubs.
It's always better to venture into certain things,
Yeah.
just to keep yourself happy and
Definitely.
Oriented. Yeah.
So we do get kind of monotonous and worked up during our day, dealing with patients. And I guess it's the story of most doctors that we have pushed our hobbies, we have pushed our alternate interests at the back.
Totally agree on that.
We always think about the patients and work. And competition has become so much. So that is one of the problems.
Yeah, I agree totally.
So I've got a few questions written up here.
Sure.
Let's see. So, of course, the whole point of this podcast is that I want to be able to portray doctors in our field, whether it's surgeons or physicians, in a way that people don't usually get to see them.
Absolutely.
We only meet them in the clinic or in the OT or in the hospital.
Okay.
So, I want to know more about the person or the man or woman behind the gown or the scrubs or the lab coat. So, that's why the name is Beyond the Scrubs. So, let's go to the first question, which is probably one of the most obvious questions.
Yeah.
What drew you to surgery as a career?
Okay. See, very frankly, I was very much well versed with what to do next after 10th. So I was not instructed because my parents are doctors. My father is a general surgeon. Both are doctors. My father is general surgeon. So I grew up in that environment. But I was never instructed or ordered to follow, go for medical. For that matter, in 12th, I had both the groups, like maths and bio together. But yes, I was pretty much influenced by all the, the vibe which is there in the hospital, which is there when we communicate and everything. So I was more inclined towards going to medical. Yeah. So once I finished my MBBS, that is just was basic undergraduation, I had again a doubt in my mind that now what to do next.
Your father is also general surgeon.
My father is also general surgeon. So again he gave me many options. Like I was pretty much oriented to go ahead with the surgical branch only, be it ortho, be it gynec or be it surgical. But what pushed me towards choosing surgery over ortho was the diversity which a surgical branch can give you. And the satisfaction after tackling different aspects of your body, not just bone per se, or for that matter gynecology. Yeah. So the diversity which a general surgery branch can offer, that influenced me to choose surgery over the rest of the things.
And I'm sure your father is one of the old-time general surgeons who does
he does
craniotomy,
everything.
thoracotomy, laparotomy.
everything.
So for people who don't know, head to toe, craniotomy is opening the brain, thoracotomy is opening the thorax, laparotomy is opening the abdomen. So old-time general surgeons where specialty was not so well developed, they are so skilled that they will operate on any case, and they are so skilled that way. So,
and that's the reason why. The motto behind everything was never say no to a case.
Yeah, of course.
That was the only thing which pushed me towards choosing surgery over everything.
I can imagine. I mean, that's pretty much the reason why I took up plastic surgery, because head to toe, no claustrophobia at all. So I can imagine.
Yeah.
So was there like a single defining moment in your life where you decided okay, that's it, I want to be a surgeon? Like one particular time that you decided?
Very frankly, I cannot pinpoint a particular incident, but it was just a huge, let's just say, amount of influences every now and then. And the journey which I grew up in, like the environment which I grew up in, that was the only scenario. But I cannot just pinpoint one.
Yeah. when did you enter the OT as a surgeon? Like the first day, how was your feeling?
It was
Your own
more,
case, like the first ever OT.
so first ever OT. I must admit, I think into my second year of my MBBS when we.
Oh, so soon.
Yeah. So we had our surgical postings and a huge number of
Where
patients
was
which
this?
were going.
Where was this?
I did my undergraduation from ACPM Dhule.
Okay.
So we entered the surgical practice, surgical postings, and that time Dr. Chitide ma'am was our surgeon that time. Very well renowned and very old surgeon at that, but very, you can say, very much open for all the new advances. So she was trying at that point what is called as stapler hemorrhoidectomy at that point. So
When was this? How many years ago?
this was around 2004 to be precise.
21 years ago.
So that time she was operating on that. So she invited all those who are posted in surgical department to, okay, go.
Come and see this.
Come and see. So that was my first official OT, which I went and saw. But prior to this, when I was like at my home, when my father used to call, come and assist, or just be there.
Yeah.
So every single time when I entered the OT, it was a mixture of emotions like little scare ki I should not touch this, I should not touch that.
It takes some time to learn what to touch and what not to touch.
And you should not utter something which will make you look fool. So that's what is the thing.
Yeah. I remember first OT for me was during my MS. I had joined, and there was one surgeon, Dr. Vimalin. So he was operating squamous cell carcinoma over the buttock. So he's removed 99% of the tumor.
Okay.
And he said, "Hey, your first day." I said, "Yeah." He just gave me the cautery and he said, "Come on, do it here." So I just did it, and then as soon as it's just the last bit of skin. So as soon as I cut it, he just drops everything, starts clapping loudly, and he's yelling, "Congrats, you're an onco surgeon! Congrats, you're an onco surgeon!" It's just embarrassing. The first day you just want to be part of the furniture. You don't want anyone to see you.
Exactly.
And he just made a big deal out of it. It's terrible.
It happens.
I mean, I'm sure your father was one of your mentors who has influenced you the most.
Yes.
What about him do you feel that you want to carry forward in your practice?
See, his confidence and I always follow this, that whenever you are taking a decision in surgery, you never hesitate your instincts.
Yeah.
Obviously, there is something called as evidence-based medicine and everything, but it's always a surgeon's instinct that makes you decide whether to operate or not to operate.
Yeah.
That I got to know from my father. And obviously, when I grew up eventually, then the one thing which I again learned from my father is when to say no to a case.
Yeah.
Whenever you do not operate.
That is more important.
Yes.
In today's world, at least.
Absolutely.
Not to operate. Yeah, I guess, it's very important. Yeah. Mentors, I feel like many people don't really get this, but especially patients. But I feel as surgeons, what we do is more of mimicry.
Yeah.
Rather than, you read a book, you learn a skill and then you execute it.
Absolutely.
I feel what we see our mentor doing, we just do that.
Follow that.
And then later on when somebody asks you, sir, ye aisa kyun kiya? And then you really don't have an answer ki kyun kiya? वो sir वैसे करते थे, तो मैं भी ऐसे करता हूँ.
Exactly.
So tell me about your daily life. What does your typical work day look like?
Work day, I specifically...
I know you work only 3 days a week. we won't tell the viewers, but sir only works 3 days a week. I mean, we need to have a separate podcast for work-life balance from him.
So invariably it happened. I didn't plan for it, but it just happened. So I'm blessed with 2 kids, both are son. So the entire day starts with taking care, like making them ready, dropping them school. Wife takes the 90% of the workload when it comes to kids. Including their tuitions and managing their studies and everything. So the morning itself goes to dropping kids, getting ready, then going to the OT. First things first is I love to start my OT at I'm very punctual. Early in the morning, I'm very punctual about it. 8:30, the patient should be on the bed.
Yeah.
So if the morning goes with the adrenaline push of multiple surgeries, your day goes well.
It goes well, yeah.
And the entire day OPD, and by evening when everything kinds of settles down, then private OPDs are there and other commitments of small surgeries here and there. Then I finish and then I go back home by, say, let's just say 9:30, 10 o'clock.
10-12 hours every day?
10-12 hours every day. Yes,
Yeah.
you can say
That's
that.
one thing which, people, non-medical people, I guess, don't really understand.
Yeah.
We don't have a 9 to 5.
We don't have 9 to 5.
Like,
we cannot, relate to a 9 to 5
It's
job
just
and
impossible. My boss used to say, there is no such thing as Sunday.
then. Yeah.
Patient है तो working day, patient
Correct.
नहीं है तो Sunday.
Very well said.
आज मेरा Sunday है. I'm sitting and recording podcast. Oh man. What do you think is the most challenging part that people don't get to see of your life as a surgeon?
See, the amount of mental stress which a surgeon, any surgeon, like for
Yeah.
you also, when you go through, when you are already, you convinced a patient and patient's relative that you need this.
Yeah.
But to fulfill that responsibility, that, अच्छा, हमने ये बोला है, but we have to act on it and accordingly we have to give those results.
Yeah.
ये mental stress, nobody sees it,
Yeah.
nobody understands it, and after fulfillment also nobody, kind of say, अच्छा तुमको अच्छा
Yeah.
लगा. No.
Yeah, they don't
It is-
acknowledge it.
They
कि-
do not acknowledge it.
कि result अच्छा हो गया, but उसके लिए how much stress we have taken.
Yes.
And
They don't.
I guess we also don't internalize it. I don't know how I deal with it. I probably get worked up and then take a break sometime.
Yeah,
But
maybe
it's
you
difficult
can say
to-
that. But this process nobody understands.
Nobody
Nobody,
understands,
kind of give it a thought also.
Yeah, yeah.
They only feel कि obviously from their perspective हमारा patient ठीक होना चाहिए.
Yeah, yeah.
But these all things are there to make that result.
Even like a relative was getting operated by another surgeon,
Uh-huh.
and they were more worried about hospital अच्छा होना चाहिए, this post-op care, ये वो. I said, just leave all that.
Exactly.
Intra-op is what is most important. I said,
Exactly.
you forget about the hospital, you forget about everything, find the perfect correct surgeon, and intra-op हो गया ना तो 95% आपका recovery हो गया है.
Yeah, true that.
The remaining thing is all just 5% follow-up, small infections, this, that, it doesn't matter.
Many patient first come, sir, हमको पहले डिलक्स रूम देखना है. मैं, क्यों? नहीं, हमको just देखना है कि अच्छा है तो भी हम यहाँ पे ऑपरेट होंगे. No, the first priority should be
Yeah.
which surgeon is operating,
Exactly.
what will be the intra-operative, post-operative complications.
Yeah.
But
The public
nobody
doesn't
understands.
understand that.
They don't.
And I guess at some level we are at fault to not educate them about it. But this thing about that is, if you impress upon the person the seriousness of the issue,
Yes.
they get scared.
They get scared. Then they start window shopping.
Yeah. And then so it's like a delicate balance. I think you learn it as you go along.
Absolutely.
Or you gauge the person in front कि इसको कितना बताना है.
Absolutely.
So of course consent and things are there. And nowadays it's more difficult because of the legal issues.
Yeah, true.
Yeah. What is a small daily habit that makes a big difference in your work?
Okay.
Like I know some people will pray before operating, or some people will. I know a surgeon who gives Reiki to the patient before operating. And it's up to you to believe or not, but then I guess it makes him peaceful.
As a surgeon, I would say, before every incision which I take, I just pray to God a small mantra which I just recite in my mind. As a surgeon, that gives me, that pause
Yeah.
from your chaos to your calmness.
Yeah.
And when you go for a surgery, so it gives me that pause.
Yeah.
And when it comes to your personal life, it's always your family.
Oh, of course.
So whenever you go home, just looking at them sitting quietly, relaxing, satisfied faces
Yeah.
of your wife and your kids,
Yeah.
that gives you the relief, and that just tells you, okay,
The
fine, what
peace.
you're doing, it's fine.
Yeah.
It's
Do you
like
listen to
that.
music while operating?
I love music. My playlist includes everything, every possible song,
Yeah.
every possible genre you can see.
Yeah. For some reason, even I love music.
Yeah.
I feel it's better to operate on a spinal level. I mean, it sounds wrong to the public, but then it's sort of like driving. I feel if I operate with muscle memory, I'd make less mistakes
Yeah.
rather than using your brain कि क्या चल रहा है.
Thanks to my elder son, I am exposed to all these new funk songs also. I don't know, maybe new German songs. French
German songs?
Yeah, he loves those songs.
Wow.
Though he understands few of them, he is good in French, but still.
क्या कर रहे हैं बच्चे
I
आजकल?
don't know. He just in his 4th standard, but he's well versed with multiple languages than we are,
Wow.
and songs also.
Crazy.
Yeah.
Do you have like a particular patient in all these? I mean, 21 years is a long time.
Yeah.
But do you have any one patient memory that has stuck with you, like one case which is like most memorable?
I'll give you 2 patients because that changed my life as a professional practitioner from a regular surgeon. So I used to work in Pimple Saudagar area. Pehle I was attached with Bharati Institute. So during that phase, we call it as a young surgeon's day.
Yeah.
It recently passed out. So one particular patient, road traffic accident patient, 16-year-old young boy, came with an entire thoracic area exposed. So it was an open tension pneumothorax. So it just happened in front of the hospital, and I was happened to be there taking rounds.
Okay.
So the patient was shifted on a trolley to the ICU. And everything was wrapped up together, bleeding and everything. No anesthesiologist was available at that point. So luck on my side, the ICU technician, so the ICU consultant could give little sedation and everything. So I did a open tension pneumothorax on a trolley.
Wow.
And luck on my side, the patient went home happily without any complications. That particular case I presented in one of the esteemed conferences in Pune, and that got picked up as the best case of the year and everything. And that gave me a push, and that made my name little more, I would say, recognized amongst the vicinity.
And you get a lot of confidence.
You get a lot of confidence.
Do a case like that.
Yes, absolutely. And the second case, which I did in Noble Hospital, Hadapsar, after joining it, where every senior consultant started taking me seriously because of that result, was one patient came with a cut throat injury, like here to here. Luckily, not manja, it was a homicidal cut. It was an assault to him, and those sugarcane workers were there. So, in little terms, he had a cut. Luck on patient side, both the arteries were intact. One side vein was damaged. Trachea, that is food pipe, the windpipe and food pipe, esophagus, both were damaged, transected, thyroid cartilage was transected. The case was denied by 3 esteemed institutes in Pune.
Why?
They didn't have expertise, they didn't have the surgeon at that particular time, and luck on my side, it came to me. And I operated on that patient. Patient had a long recovery with a tracheostomy, that is again a windpipe, and then patient after 2 odd months completely recovered without any hoarseness of voice, without any difficulty. And that gave me a lot of confidence, and that, I must say, that particular case changed my your
perception,
overall,
how people looked at you.
Yes, it did.
I think that's very important in our situation, how people look at you, because
that carry a lot of significance. I must tell you.
I know there's a lot of things that you can say about yourself or your credentials can talk about, but unless you really manage a patient and operate them and get them well, people don't really, you know, verified का badge आ जाता है.
Yeah, verified.
Tick आ जाता है.
Blue ticks.
And I'm sure anesthetists will go and tell.
Yes.
बहुत अच्छा किया.
They are the biggest supports as well as they are the biggest marketing.
Very dangerous. You have to be good. A good case.
Yeah.
Have you ever had a case that kept you awake at night, and why? Every week you must be having
absolutely.
one case.
There are many cases which we come across after surgery also, even if you are done your 200% best. But still, one or मैंने वो stitch तो अच्छे से लिया था क्या, वो bleeder तो मैंने coagulate किया था क्या. So few things here and there only surgeon can relate to. Not even assistant. The surgeon will only get to know, अरे ये थोड़ा सा था यहाँ पे, and that obviously, since you are dedicated to the patient's overall health and everything, that keeps on lingering in your mind. Yes.
Like I'll tell you, yesterday I did a free flap and I got a call at 10 p.m. saying, "So the flap is not bleeding." So I said, "ऐसे कैसे? I just saw it at 9 o'clock. नहीं हो रहा है." I said, "Video भेजो." And then in the video I see that they are checking by just pouring saline on it. I said, "Scratch कहाँ किया है?" They said, "Scratch करना है क्या?" I said, "Scratch नहीं करोगे तो कैसे पता चलेगा?" नहीं, we just put saline on it. So then, you know, you have to go in the night, you have to see, and then free flaps also, I mean, I monitor it regularly, but keeps you awake at night. I can totally imagine. Do you have any funny moments in the OR, apart from breaking instruments and throwing them?
You don't have to bring this up. If the instruments are not holding, I have to break it. Obviously, I do that. I do that.
Because it keeps coming back.
Obviously.
And that's what is irritating.
Obviously. No, funny things, it happens when suddenly when the patient is under general anesthesia, and if the general anesthesia is like a little weaning off. And the anesthesiologist is obviously busy in administration. That fraction of second patient moves a little bit. So that makes a little bit of funny.
Sometimes it's fun, how do you think general surgery has changed from the time that you started, say, 15 years ago to now?
It has changed drastically, not from the medical point of view, but the perception of patients and overall population, yes, it has changed drastically.
In a good way, or what do you think?
I will keep it as a neutral, because in a good way I cannot say that, because obviously super specialties have come.
Yeah, and I don't like that. I mean, personally, if you ask me, I feel general surgeons, because I've studied in Vellore, and there is no super specialty there. I mean, it's only plastic, vascular, and endocrine.
Yes.
The rest, head and neck, upper GI, lower GI, everyone the general surgeons do.
Correct.
And they are so much more skilled, and I guess, of course, passed down from experience from the seniors.
See, apart from the expertise which a super specialist has, the general surgery perception has changed in what context is whether this general surgeon is better technically or technically sound or technically advanced apart from his expertise. So the surgeons have been judged now is not by how good he's performing, but how good his social presence is. So it's कितने सर्जरीज किए, कितने सक्सेसफुल है, उसके ऊपर ज़्यादा कोई ध्यान नहीं देता.
रिकॉर्ड और ये वो सब
उसके ऊपर nobody gives a thought. Always and everyone thinks about इसको गूगल पे कितने रेटिंग्स हैं, कितने लोगों ने इनको स्टार दिए हैं, and how much good he is socially. So that in that perspective, yes, it has changed a lot.
That's true. And I don't know if, I mean, I see it in my practice also, where suppose a patient comes to the ER and needs a surgery. Sometimes I think कि ये patient ने agree कैसे कर लिया मुझसे operate कराने के लिए? Because I don't know him. There is no, like, you know, कहीं somebody knows him sort of an angle. Correct. But they agree for surgery. And many times I feel क्यों मतलब, and then the patient, one of them told me कि हाँ सर आम्ही गुगलवर बघितलं तुमचं प्रोफाईल बघितलं आम्ही. I said, why यार? मतलब you put yourself in that place.
Yes.
Will you ever get operated by someone just by their Google rating?
No, never.
आप 10 लोग को पूछोगे कि कौन है ये, कैसे करता है?
Never. The only prime thing which I believe in is you go to the surgeon, you put your 1,000 queries in front of him. If he's not able to satisfy that, don't get yourself operated by that person. If the surgeon is meticulous enough to explain each and every aspect to you, there will not be any other surgeon who can, give better.
Who's that invested in you?
Yes. So
but
that's
what about
the way
these
you should judge.
Celebrity surgeons who are so busy that they don't have time to talk to patients?
They are celebrity surgeons.
Okay, so coming to a good question.
Yeah.
What are some myths in surgery that you would like to debunk?
Myths
that the public might have.
Surgeons earn more than.
So looking at you, I think that is no longer a myth.
No, it's a myth. Come on, yaar. You can credit my look to my wife. Actually, she takes care of my everything.
No, but I do agree. Surgeons, capacity to earn is a lot.
No, the myth buster is the hospital earns, not the surgeons.
Of course, yeah. That's true.
So it's not like. इतना बिल हो गया तो सर्जन को इतना no, it's not like that.
Yeah, it's not like that.
It's
definitely not like that. Although we won't out those secrets. But yeah,
it's beyond the.
It's beyond the scope of this podcast.
Exactly.
We want to still be employed at the end of this. So, any other myths regarding like surgery, anesthesia, or something like that?
See, usually what people have there in mind is, अच्छा surgery होगी बात खत्म. It's not like that. Surgery is just the first step on your overall recovery from the illness. So surgical part, though it is technical, it has lot of things post-operatively. So going back to your normal routine and everything takes a lot of time, and that people don't understand. Now the marketing gimmick is like this: एक दिन में आ जाओ surgery करके continue. So this marketing gimmick has fooled the entire population, left, right, and center. And that people should understand, and it's a myth what a marketing team or let's just say.
They do it to attract patients.
Yes, they do it to convert the patients.
And it's not nice because even though technology has advanced, biology has not advanced. Biology remains the same. In fact, biology, if anything, has deteriorated because plastic exposure, poor nutrition, smoking, alcohol.
Absolutely.
You can say that biology has deteriorated. So, especially I find this with slightly more well-to-do patients who come for surgery, and
Yes,
they have a complication, and then they have no tolerance for complications.
They don't
because they don't have any inconvenience in their everyday life.
Yes.
तो अभी इतना बड़ा inconvenience हो गया है कि wound infection हुआ या
Yes.
wound gap हो गया या you need a second surgery. They just can't accept it.
They just can't accept because their mindset is well driven by the marketing team ki ऐसा है. No, it's not like that. That's the myth they always carry.
Yeah. It's always like, we facilitate healing.
Yeah.
We don't do the healing.
We operate and he heals.
He heals, exactly. So it still holds true today.
True.
Definitely. What do you think is the next big breakthrough in surgical care? That you think that you will be able to bring about?
I think in my department or in my specialty, I will say the robotic invention and nanobot technologies for endovenous or intra capillaries healing process can be just a breakthrough. Still, it is now AI driven everything, but in next 10 odd years we can come across many things, and again smaller instruments and better care. We can
do you
think
do robotic
about
surgery?
I do robotic surgeries.
And does it really have a benefit?
Yes, definitely it has. See, robotic surgery has a benefit over laparoscopy in 2-3 contexts. One is deeper, good visualization of the anatomy because it's 3D.
Okay.
And less tremors when it comes to patients' instruments handling.
Because the robot is...
Robot ports are there inside. So, and the recovery, because tissue handling is very precise and very small and very, I would say precise again. But because of that, the post-operative pain is very much less.
Okay.
So that...
So you can do major procedures?
Major procedures also, including...
And quick recovery?
Yes.
That's good. Let's go to some non-medical questions. If you weren't a surgeon, what would you be today?
Okay.
Forget surgeon, if you weren't even a doctor.
Okay, this may sound a little weird, but maybe I would have been a professional video gamer.
I think in the first episode itself, we have got an answer that cannot be topped in any other episode.
I love games.
Is there even a profession like that?
They earn way beyond what we can imagine. Professional video gamer earns through tournaments, earns through podcast, earns through live relays of their games.
There are podcasts.
There are podcasts
for video games.
Oh yes. And plus, I would like to add on that an action figure collector.
Wow.
I am in love with all the action figures. I, kind of fulfill my
I think it's a blessing
hobbies.
You have 2 sons.
Yes, I was about to say that. I fulfill my hobbies through my sons.
Yeah.
Like I make them buy, अरे ये नहीं ये बाइक कर, ये अपने पास है, ये हो गया अपने पास सेटअप, ये बाइक कर.
I have to come and see this one day.
You should.
What is your go-to comfort food after a long surgery? Food, huh?
Okay. It has to be sweets in any form, like ice cream can be there, dessert, anything, or just basic nice cold coffee.
That's good.
That can be there.
We have a ritual after free flap ki maida to khana hai. So
maida to khana hai.
So butter naan has to be there. No healthy food after a free flap.
Okay.
Any other message you have for our listeners in closing?
See, every profession has their own ups and downs. So when you guys from any profession comes to us, we never judge you or your anything depending on your profession. We judge and we listen to you as a person.
Yeah.
So you should also understand that a surgeon who's operating you is also a person.
Yeah.
Is also someone who will, apart from his surgical expertise, will obviously
he has a human side to it.
There's a human side to it. So he will also have his own opinion, non-surgical opinion when it comes to patient care, and also post-operatively also he will have some advices as that. So you should always think about surgeon not as a as a machine to kind of just go do it and come back. No, he also has that kind of a thing as a human touch to it, which nobody can think.
That's a great piece of advice. So I guess that brings us to the end.
Oh, that's good.
Thank you very much for coming, sir.
Thank you for
starting this podcast. Let's hope we have many more episodes, and I'm sure in a few years we'll have sir back again as a guest with even more experienced stories to tell us.
Absolutely.
See you.
Thank you.